This is Dr. Jacques Morcos presenting a case of a resection of a right carotid body tumor in a 45-year-old female with neck mass and hereditary paraganglioma. The MRI demonstrates the neck mass and the CTA shows the splaying of the internal and external carotid. It is confirmed on the dotatate scan that it is very avid in uptake, and the angiogram demonstrates the classic appearance. Embolization preoperatively was carried out with onyx. And here is the surgical dissection and resection of the tumor. With the tumor lifted up, we have a nice view of the hypoglossal nerve crossing the field, and I performed an ICG Glow 800 run before continuing the resection to demonstrate the common carotid, its branches, and the jugular vein. They are clearly seen. The dissection is carried out in a subfascial manner, as should be done with carotid body tumors. I like to use disposable irrigating non-stick bipolars for this surgery. A small branch of the external carotid was injured during the dissection. A bulldog is applied to control the bleeding from it, and a vessel loop is manipulating the external carotid. The bleeding site is easily controlled. The dissection carried further along the internal carotid artery, and with the help of an assistant, the tumor is rotated from one side to the next, and it is very important to stay very close to the capsule of the tumor to avoid injury to the nerves traveling in the soft tissues of the neck. Several times, blunt dissection, even with the finger, proves very useful. At this point, I amputated part of the tumor and now completed the resection. Now we perform a post-resection ICG run. It demonstrates the jugular vein, the common carotid, the very vivid internal carotid. And I had a question as to whether there was any residual tumor at the top of the resection cavity. And both the Glow 800 right there under the suction and the inset of black and white ICG run demonstrated that this is not residual tumor, but that this is vasa nervosa on the cranial nerve 9, the glossopharyngeal nerve. It was not possible to make that determination just looking through the microscope, and the ICG run, and particularly the Glow 800 addition, was very helpful. Here I am experimenting with the software of the Glow 800, trying different colors for various contrast between green and purple and indigo and blue and other shades, and I ended up preferring using the green.